Good evening and welcome to yet another session of our special series on liver cancer awareness. I am Kamal Narayan, CEO of ISW Council, India's premier institution for health advocacy, awareness, and behavior change. The month of October has a special significance in the world of cancer care. While we hear a lot about breast cancer in this month, and rightly so, as it has become a major cause of concern globally and in India, not much attention go to liver cancer despite October being the awareness month for this as well, and something which affect the very critical part of our body. Though lesser compared to other form of cancers, yet liver cancer is among the fastest spreading forms of cancer in our country. Cancers are known to be the emperor of all maladies and leaves many times disastrous impact on lives of not only the one who undergoes this but also to their families. And this is despite the fact that with advancements in medical science, many of the cancer can be prevented or cured with early and timely treatments. Still, we at India see a lot of mortality primarily because lack of preventive practices and late detection of cancer cases. To understand what are the causes of liver cancers and what are the perceptions and myths that hampers the prevention, diagnosis, and treatment of liver cancer. Today we have with us a very esteemed panel of experts, and let me welcome Dr. Shiv Sareen, Director, Institute of Liver and Biliary Sciences, New Delhi, which is the first of its kind in Asia. Dr. Sareen is among the most respected expert of liver diseases globally. So thank you so much, Dr. Sareen, for sparing your time and joining us today. He has been championing the cause of hepatitis B, C, and liver cancer prevention and cure with undying passion and focus. We have with us Dr. G.S. Bhattacharya, consultant medical oncologist and clinical hematologist from Salt Lake City Medical Center in Kolkata. Dr. Bhattacharya is also among the topmost oncologists in our country and practicing for very long time in our eastern part of country. Thank you so much, Dr. Bhattacharya, for joining us today. We have Dr. Somasekhar SP, Chairman of and HOD of Surgical Oncology from Manipal Hospitals in Bengaluru, and Dr. Suresh Babu from Fortis Cancer Institute, Bengaluru. He has been working as an associate professor at Kidwai Memorial Institute of Oncology as well. We are also joined with Dr. Siris as Alurkar, Consultant Medical Oncology, Apollo Hospital in Gandhinagar, Ahmedabad. So a very warm welcome to all our esteemed experts who are veterans and finest medical experts in their respective fields. However, before I begin our conversation today, I would request our online viewers to keep sending their questions on the comment box, and we will try to answer most of them in our next hour, 1 hour so. And also like, comment with your feedback, and do share this space also on your wall to help many others who may get benefited with this important information. So let me begin with Dr. Sareen. Dr. Sareen, I think nobody knows liver better than you. What is that, what are those liver diseases? What are those causes which are making more liver cancer cases or causing more liver cancer cases in our country?
Thank you, Kamal. You have already covered, like a doctor, most of the background very well. Thank you for inviting, and I am really very happy to see such a distinguished panel of experts. I would be available because of two emergencies only for a few minutes, so I may say some of the things which I think are important for us. Liver cancer was declared to be the second common cause of cancer deaths by WHO in 2014 worldwide. And Tata Memorial study showed on virtual autopsy that it is the third common cause of cancer deaths in India. It is expected to become number one if we don't work by 2030 as the commonest cause of cancer deaths. Why so? Five things have to be understood. One, liver cancer occurs in patients who have got hepatitis B and liver disease. Two, hepatitis C and liver disease. So B and C are viruses. Three is obesity with or without liver disease. Four is alcohol abuse with liver disease and liver cancer. And number five are several other conditions of bile duct or liver which can cause combined cancers. All these are preventable or treatable causes. Hepatitis B, one can suppress. C, one can eradicate. Obesity, you can handle the fat in the liver. And alcohol, of course, you have to overcome your weaknesses. Having said that, why cancer develops, and since this is a general awareness, it's not a highly specialized area, I would like to say that the cancer develops as an attempt of ongoing inflammation overcoming your body's own defenses. What inflames the liver? Virus, fat, and alcohols. If there is a constant inflammation, cancers develop. Therefore, avoid inflammation, let the liver remain cool. Second concept, remember, is an enzyme called ALT or SGPT. If a person has high SGPT and obesity, high SGPT and hepatitis B, high SGPT and hepatitis C, it means liver is inflamed. So there are two markers, one fat in the liver, obesity, or a simple enzyme 10 rupees test, SGPT. If your SGPT is high, in fact, today if you have to marry your son or a daughter, don't look into Kundali, look into SGPT. उसका SGPT 80 है और वो 26 साल का है, 36 साल तक उसको कुछ ना कुछ हो जाएगा. He can have heart attack or some other problem. So have the SGPT as normal. The last important part is liver cancer, the awareness. People don't die of cancer of liver, they die of liver failure. So let us say this is a paper. If this is a new paper, you have no worries even if you cut it into half. But if there is a weak paper, गल गया हो, खराब paper हो, आप उसको आधा काटेंगे पूरा गया. So if your background liver is good, if the liver has good function, presence of a tumor does not bother. We can cut it, we can burn it, we can char it by microwave, we can block it artery, we can do any of these things. So keep the original liver and manage the area which is tumorous. But if your whole liver is bad, you can't do anything. भाई jaundice हो गया, पीलिया हो गया, bilirubin 3 हो गया, then you have to transplant. Now, why people come late to us? Firstly, if you know that you have hepatitis B or C, but you never get tested. If you are obese, you still continue to remain and keep on drinking. So please remember the high risk category. If you are diabetic, you have a chance 2.5 times chance of liver cancer. Compared to normal person, a diabetic is 2.5 times. If somebody is obese, his risk of liver cancer is 2.5 times. If he is obese, diabetic, alcoholic, it is almost 4 to 5 times. And if he is above 45, his chances go to 8 times. So obese, diabetic, going to gymkhana, and above 45, these are high risk. So please protect your liver, get them screened every 6 months. Earlier, we used to do ultrasound. CT scan. Now we measure stiffness. A liver which is hard has a chance of tumor much more. And this is easily tested by tests like fibroscan or by fibrotouch and other methods. If your liver is hard, normally stiffness of the liver is measured. It should be less than 6. Don't worry about the unit. But if it is 20, 30, your chance of cancers go high. So let's revise who has a high risk: obese, diabetic, and alcohol, and has a high SGPT, and who has a hard liver by fibroscan. They should get every 3 to 6 months blood test and assessment. Blood tests are simple. One test is SGPT, one is alpha fetoprotein, a marker of tumor. So, just to put everything in perspective, we can prevent by treating B and C and obesity and alcohol. We have to identify the high risk groups who do not have liver disease but have just have a screening program. Those who have liver and cancer but do not have jaundice, they have early liver disease. You can manage them by burning, by microwave, by stopping their blood supply. All that is possible. If you have done that and the tumor is less than 2 centimeter, you are okay. You live like others for 5 years. If tumor is big, it is 3 or 5 centimeters, the chances of survival go down. Such patients or those who have got have a problem. Now comes, and I have very good experts here, oncologists. Very many new drugs have come. I mean, it's like bombardment of new drugs. These new drugs have a different way. I'm sure you will hear from the experts. One is by chemotherapy. Second is by immunity raising. We see close to 1100 liver cancers every year. And of those, most are late. But still we treat by immunotherapy. It means body's immunity is raised to find out the cancer cell and kill it. Body अपने आप अपनी army निकालेगा by this therapy and will kill the tumor. On the other hand, in chemotherapy, you find out which is the cancer cell and give it. So we do about 100 plus immunotherapies, very effective, very safe, but still there is a chance. Now, who is going to die? And don't waste patients' money. My last message: if patient has jaundice, deep, if patient has fluid in the abdomen, and patient has a tumor which has gone into the veins of the liver, such patients must know that you have to rest at home. Don't run from X doctor. Dr. Serene अच्छे नहीं है, दूसरे के पास चलो. Dr. Serene अच्छे हैं, उनके पास पैसा नहीं खर्ची. पैसा खर्चने के लिए अगर बीमारी लाइलाज हो गई हो तो बिल्कुल टाइम और पैसा वेस्ट नहीं करें. अगर जॉन्डिस है, अगर मतलब पीलिया 3 से ज्यादा है, अगर पेट में पानी है, आपका एल्ब्यूमिन लो है, मीन्स योर लिवर इज गॉन. No point in treating the tumor. So you can give nutrition, give him good confidence and good quality of family life. With all that, we have a miles to go. And Kamal, thank you. You are an old and very strong hat in this area. We must keep awareness not only for month. I think every month we should have something like that. And I salute all my other panelists, but allow me to leave. If there are questions, I can handle them later.
Thank you so much, Dr. Sareen. You actually covered most of the things and very well, covered. And the most important message which you have communicated is that keep your liver the way you got it. You can protect and prevent most of the diseases if you are conscious and careful about your liver. And most of the causes you said are all preventable, related to lifestyle, our own choices. And we need to start making the right choices, I think. So thank you so much, Dr. Sareen. And we'll continue with the others, experts. Thank you for joining us. So, Dr. Bhattacharya, we heard about that, liver cancer, what all is being caused, or causing liver cancer. But when, let's say, if somebody has got liver cancer, what are the ways to, get out of it? Is it early detection? And how early we need to detect? And what are the possible chances of survival.
Thanks, Kamal. Thanks for bringing it up, and I'm going to try and pick it up from where you said, and also pick up from where Dr. Sareen said it. So let's start from that point. Worldwide, the data says that liver cancer is rising. And I'll give you an idea. There's a myth. Going back to your original thing that liver cancer is a disease of poverty. Liver cancer is a disease of poor nations. That is not true. The US data, the European data tells us is a 40% increase in incidences of liver cancer, both in USA, Canada, and in Western Europe. So the first myth we are breaking. It's a disease all over the world. The type of disease varies between the two parts of the world. Second, Dr. Sareen left a very important statement, and the statement is liver cancer is a preventable cancer. And this is an important statement he made because in India, 60% of all liver cancers are caused by hepatitis B. This can be prevented because we have a very good vaccine available against hepatitis B and a cheap vaccine. So this is one step that has to be taken for prevention of hepatitis B. The other prevention is, like in India, hepatitis C causes 30% of the rest of the cancers. So 60 plus 30 is 90% now. So 30% of hepatitis C is treating hepatitis C so that it doesn't become chronic. So you can prevent liver cancer. Then comes up an important issue, and this I think a lot of we talk about and we don't speak too much about it, is that there is a particular fungal toxin called Afla Toxin. This toxin comes up from peanuts. If you have old peanuts, which has been stored for a long time, it grows a fungus, and this fungus can affect your liver. Why this is important? Because unlike in the Western world, you see most of the hepatocellular carcinomas in the age group greater than 50. In India, there is a subgroup which is between 30 and 40. These have an exposure to aflatoxin. So this is a place which becomes very important to keep in mind how we can take care and get the other multidisciplinary or things into order so the food storage and prevention of this doesn't take place. I'm not going to give into the other causes because I would like Dr. Babu or Alaka to take it up, or Soma will talk about it. So let's move a bit more ahead and say that when I treat a patient of liver cancer, that is, a cancer patient comes to me, a couple of things come into my mind immediately is treat the liver, treat the cancer. You can't treat the cancer if you don't treat the liver. You can't treat the liver if you don't treat the cancer. So hand in hand, steps that start moving is liver cancer is treating both together. For example, I'll try and explain to you. Suppose I have hepatitis C and I have a liver cancer patient. I have to treat hepatitis C and I have to treat the liver cancer. Or if I have hepatitis B and I have liver cancer, I have to treat hepatitis B and liver cancer. So that's an important thing that we have to know what to treat and how to treat. The treatment of liver cancer, I'm sure Dr. Shomshekar. Soma actually is a very good friend. I've got used to calling him Soma, that everything goes haywire. So Soma actually will take it over. He'll talk, I'm sure when he'll talk about surgical aspects to this, which he understands very well, is that we follow a particular method, and that method is we try and tell you, which Dr. Sareen very put it simply, that if you must know when to treat and when not to treat. So this when to treat and when not to treat is commonly followed by a thing called Barcelona liver criteria. I will not go into that part. I'm sure others will cover it much better. But the Barcelona tells you what you treat and what you don't treat. And what you treat, how you should be treating, is what Barcelona criteria tell you. Not a perfect criteria, but a reasonable criteria. Then comes up an important issue that when we talk about liver cancer is, do remember something. There is one entity in liver, and my request to all my medical oncologists is that if you get a liver cancer, if that is resectable, send it to the surgeon. We don't need to transplant every patient. Good number of liver cancers are resectable. Let us not miss that resectable chance, because that gives you a long-term survival benefit. The other thing that is very important, Kamal, let me try and put it across to you, is that liver has got, a real multidisciplinary team today. Uh, like we need the liver specialist to keep the liver in order, and we need our oncologist colleagues to keep the oncology in order. So we have Soma as surgeon, we have Suresh and Sirish, we are all our medical oncologists, including me. There's another group of specialists which are called interventional radiologists. They do certain things which are called bridging treatment or even very good palliative treatment, to which we add on certain things. Now, there's an important aspect in India when we talk about liver cancer treatment, and that treatment aspect is economy. The drugs that we treat liver cancer with are not cheap. And when I say cheap, Kamal, I mean to say that 40% of India lives below $2 a day. That works out to be $60 a month. Roughly, it comes to 4,800 rupees. The cheapest liver treatment that we have of today is more than this. So this is a headache I'm sure Suresh, I'm sure Shirish, we all face when we make the decision when patients come in to us, that how do we treat them? Yes, if you really asked me, 5 years back, we had one drug. Only one drug to treat this with. 10 years back, we had no drug to treat with. In fact, I'm sure Suresh would remember that 2 years back, I gave a talk, 10 years of sorafenib. That was the 10th year the sorafenib had come into the market after being approved. So I gave a talk, this was in Jaipur, 10 years of sorafenib, basically. So let me be very honest with you that before sorafenib, literally there was nothing. Sorafenib first drug, then gradually the drugs are built up. And today, on today's date, we have 9 drugs that can be used in liver cancer, of which one of them has just been approved yesterday. So you see, the basket is opening up, making things very difficult. But to go back again to what Dr. Sareen said, prevention is the primary thing. So you prevent primarily by the vaccines and treating the liver cancer or preserving the food properly. The second prevention is early detection. Please remember, Dr. Sareen has very clearly put it who are the people who should go for detection. And they have to be screened and screened regularly so that we can pick it up. And I like the language he used, that a 35 years old person who's got a raised SGPT, I add on to that, and I'm sure Suresh will agree and Suresh will agree to me, that if you add the word CRP to it, it actually improves everything. There is a score, it's called Modified Mcdowell score, which tells you that this person is in high risk. This is a very simple score, no extra test required. It depends on something very small. You do a blood count, look at the neutrophil and lymphocyte ratio. The blood count costs about 200 rupees. Get a SGPT done, it gets about 40 rupees. Get an alkaline phosphatase done. You may get the liver stiffness done by using a sonoscan or a sonometer for fibroscan. And then you put it down into a thing and saying that if this is the value, this patient goes in. And now let me tell you, there's data in India which says 20% of our population below the age of 30 are prone to develop chronic liver disorders, of which cancer is one of them.
That's an important point, Dr. Bhattacharya. And as you said that, liver cancer, you talked about the 50% because of, hepatitis B, 30% because of hepatitis C. So almost 80% of it is caused by hepatitis. And then, you also talked about Afla Toxin, which, I think many people or most of the people would not be aware of. Dr. Soma Sekhar, what are the, because Dr. Bhattacharya left some of the causes to be, kind of covered by you and the others. What are the other causes of liver cancer and how we can prevent that?
Thank you, Kamal. Before I start, it's very important to know WHO, for us to make it aware, there is a ribbon for every cancer and there is a month which we celebrate. Now, October is the month of liver cancer awareness month for us. Like how for breast cancer, we have a pink ribbon. Like that, for liver cancer awareness, we have emerald green ribbon. So this is the day we say, I care and I wear this, and people will ask, oh, what is this? That's when you say what it means. It is rightfully told that this is one of the cancer which is preventable, even though largely hepatitis B and HCV are there. Remember, they are also parentally sexually transmitted disease. So there are a lot of things which we also play a role in getting this hepatitis B virus, which is 50% cause of the cancers and 20% is HCV. But there are other preventable lifestyle dependent which we cause. Like number one, corn staple food, aflatoxins is very important. That's why taking a good food which is hygienic, healthy is important. In addition to this, not many people know beetle net and iron overload, contaminated drinking water, bad lifestyle, alcohol. Alcohol, it's very important that 7% of all liver cancers is because of alcohol alone. It is postulated that out of 100 people who have become habitually dependent on alcohol, 2.9 people develop cancer. So alcohol, tobacco, then betel net, diabetes, obesity, high body. So these are all preventable lifestyle related. Even HBV, HCV, even though they are, to be frank, they're also a lot of, lifestyle dependent because they are spread by parental, the types of our habit. So these are all the risk factors which are available. And even though, this is the sixth most cause of cancer, but it's a very large cause of mortality. To such an extent, last year in India, we had 27,670 liver cancer. But the worst thing for us to know is only 18% are alive at 5 years. So we have a cancer which is preventable. In addition to HBV and HCV virus, we have a lot to do with our lifestyle, alcohol, tobacco, NASH, diabetes, obesity, which is there, which has a very high chance of mortality. So it's very important to understand in October, emerald green, through such talks, it's very important to understand this is preventable cause of cancer. Mortality can be prevented. And a lot of people think that, okay, liver is a chemical factory of our body. Surgical modality in a patient who comes, liver is, say, fantastic organ which has got beautiful regeneration. You maintain your liver well. Not many people know in surgery, we can cut 75% of healthy liver, leave them with 21% only. Liver has got 8 segments. We always complain to God, 2 kidney you gave, 2 hands, 2 eye. Why 1 liver? But there are 8 liver in 1 liver. Not many people know. We call that 8 segments. If you remove all the segment, leave only 3. In 21 days, it grows back. Which other organ God has blessed us? So maintain your liver healthy. God has given an organ 75% is saying sacrifice or donate. Still 21% is enough for us to do. So that's why if you keep your liver healthy, there are special software we analyze called the FLR. Functional residue is 21%. You're not destroyed your liver by drinking alcohol and ending up with cirrhosis. You can, if you come with a liver cancer, even up to 5 centimeter tumor cancer, but liver is normal, surgery can cure by 75% without any other modality. Because surgery is one modality. If surgery fails, that is when you have ablative technique, but this microwave, radio frequency, all helps if they are around 3 centimeter. The moment you cross the critical 3 centimeter, touch 5, surgery is the modality, and that is dependent on how healthy you kept your liver. You knowing very well that God has given a most pardoning organ. It's in our surgical training. It was told, I did my liver cancer training in Paris Paul Brousse Hospital. It is told that no other organ God has blessed it. You do error, it grows up. It's like something which is just grows up. All you need to keep is 21%. But keep your liver healthy. Don't destroy it with drinking. The ablative modalities are not essentially curative unless you come in 3 centimeter. And then not everybody is lucky enough to have a transplant. Remember, organ is very difficult to get. Whom would you find? You will find a pediatric guy, healthy guy, non-cancer guy, first in the waiting list. Rarely for a cancer curative, even though it's fantastic for us to do. That is when we have a lot of other medicines, special nuclear medicine therapy, where the uniqueness of the liver cancer is liver has got 2 blood supply. One coming here, one coming here. This is a blessed organ with 2 separate blood supply called hepatic artery and another. Cancer comes only from 1 blood supply. That is the beauty. So when you leave a nuclear medicine drug or a medicine to liver, there are 2 blood supply. You leave to one, it goes to cancer only, doesn't kill your normal liver. If you leave to the other, it goes only to the normal liver, doesn't kill the cancer. So God has given 2 channels. Normal people, walking normal cell, another area where cancer. So there are technique where we give this medicine through the artery, which goes to cancer, don't give through the vein, normal liver. So there are a lot of modalities available immunotherapy, but the bottom line is, no, during this month of emerald green, keep your liver well. Don't blame the virus alone. Please maintain no tobacco, no iron overload, contaminated water, high diabetes, obesity, betel net, aflatoxins, alcohol is with you. Control that. Keep your liver healthy. When and if anybody has a cancer, this is something which doesn't chemo helps much. And 18% only are alive untreated at 5 years. Good modality of surgery, special medicines and ability is available. So this is something we take a pledge today and wear a emerald green and tell, not only I maintain my liver, I spread this knowledge to everybody and we can prevent the mortality. This is only second to pancreatic cancer in the worst cause of death.
Thank you so much, Dr. Somasekhar. Actually, the way you described liver, I'm kind of getting, falling in love in my own, liver. This is wonderful, 75% of our organ you can remove and still it will grow back. That's, I think, as you very well said, that nothing can be much more blessed than our liver, and which is such a, and I think the God designed it that way. Dr. Siris, Dr. Somasekhar talked about what not to eat, which can damage your liver. What you would like to talk about liver cancer, but along with that, what we should do to kind of promote the health of liver, such a blessed organ, how we can keep it in a shape, in a nature, in a form that that the way we got it, or even make it even more healthy.
Yeah, thank you. The very good initiative you have done on this, the hepatocellular carcinoma. Am I audible?
Yes, sir.
Yeah, so what not to do and what to do, that's a very difficult question. As far as the obesity part is concerned, it is the lifestyle. Dr. Somsekhar, Dr. Bhattacharya, many of them told. So now what exactly you mean by obesity and how do you go about it is reduce your fat intakes, because a lot of fat deposits goes into the liver. So that would be any sort of fats. There's nothing like a good fat or a bad fat or this sort of oil or that sort of oil, just basically fat. What is also important is exercise, which is somehow not really stressed upon even by doctors. We don't really tell the patient that do exercise. We just tell do exercise. What is exercise? We have to tell them at least a good amount of 45 minutes vigorous exercise depending on your age. That's what it is. You have to really have a good sweat, and that is what is known as a good exercise. So these two things are very important, and most important, of course, you have to stop. You have to love your liver, just like you love your body. So you have to love your liver. You stop alcohol. There's no other way, no shortcut about this. And to tell you also that there's nothing like a good alcohol and a bad alcohol. So that's of course we're not going to discuss on this forum here.
You are also saying that there is nothing called moderate alcohol consumption as well. Because many times we hear that consume alcohol moderately, for socially purpose only, not so. As you are saying, there's no.
So in our Gujarat, where it's a dry state, we get alcohol permits, right? So if I'm over 40 or I think 45 years, I get a permit to drink alcohol for my health purposes, for my heart. But it doesn't mention not to drink for the liver. So that's the thing. So there is some, some government issues and these are. So I have to fill up a form which tells me that I have to use it for a heart purposes only. But it never mentions about the liver.
Okay. So when you may be saving your heart, you may be damaging your liver at the same time.
Maybe, yeah. Maybe.
Thank you so much. Yes, Dr. Sisir.
The hard drinks, of course, I feel the hard drinks, definitely they will damage the liver. But I think you go for the softer versions of alcohol. If you really want to take alcohol, you may go for that. Yeah, there are people who take it on a very regular basis, very disciplined drinking, I call, and they are okay. The livers are normal. So that's also there.
Thank you, Dr. Siris. Dr. Suresh Babu, what you would like to add on this? And before I go to the questions from the viewers which we are getting.
Yeah, I think the prevention part most of the people covered. I think if you see chronically, the majority of the cancers are caused by hepatitis B, first thing is you must get vaccinated. If you are vaccinated, your cause of developing liver damage due to hepatitis B will be avoided. Second thing is the physical activity. The third thing is diet modification. Diet modification is, particularly in the literature, it is mentioned that you consume more of vegetables, fish, and vitamin E could be a protective for the liver. Usually in the western part where they eat, try to avoid red meat, whichever is there. So try to consume more of a white meat rather than consuming a red meat. So these are some of the diet modifications which are required to protect the liver. The third thing is that the diabetes should be kept under control, because diabetics are more prone for the developing the the liver cancer and all those things. So alcohol and liver, there is no exact cutoff that what amount of alcohol will cause the liver. Of course, the social drinking once in a month will not damage liver so much, but the alcohol, what is the exact dose it will cause the liver cancer or whatever it is, there is no clear cut, but alcohol do cause liver damage, even the smoking. So most of that, what happens is, most of the patients, they will have multiple factors. They will be obese, they will be smoking, they will also be drinking alcohol. So these are all some of the things which will contribute to that. So you have to avoid all those things. Second thing is drugs. Some drugs can cause, so when a physician or somebody prescribes you drugs, some drugs can cause liver damage. You keep a watch on the drugs what you consume. You always take the drugs based on the doctor advice rather than taking on your own. Sometimes what happens in our country, they go to pharmacist and they will say, I have got pain, and they will take the paracetamol and all those things. They just take to continue for years together, which can cause the liver damage and all those things. So I think Dr. Suresh already spoke about the physical activity. So avoidance of alcohol, getting vaccinated, reducing obesity, controlling the sugars, and keeping healthy by exercise and all those things. There are some evidence literature telling that consumption of coffee may give protection to liver, but we have not clearly established that. But anyway, it's better to avoid the risk factors rather than going for other things. So these are some of the things which you can avoid the liver cancer and keep your liver healthy.
Thank you, Dr. Babu. Important aspect you have highlighted, that we have to include and ensure that we are avoiding the risk factors rather than looking for that what is promoting it. So first thing we have to stop the risk factors. We are getting a lot of questions from our audience also. So let me go to Dr. Bhattacharya. And Dr. Bhattacharya, you are trying to speak something. I think you are on mute.
Yeah, I mean, I just wanted to make a couple of comments on what we have spoken till now and tell you that there is one aspect, Mr. Narayan, that even in all these meetings, the media, the people, we don't talk about, and that's called social determinants of health and their impact on health. All of us have touched on it, but we have not given it a platform. Unfortunately, our government, we don't have a proper method of saying what a social determinant of health is. I was in a meeting in a US-based Indian Institute of Medicine's meeting where this is an important aspect to talk about, at least for a disease like this. And the other thing that I really wanted to highlight is, that looking at liver cancer is a comprehensive problem which we have to look at. You can't look at it. Anyway, we can go back to your question answers and keep talking.
No, thank you so much. We'll try to touch that as well. But the one question which we are getting is that, and many of the questions are already been answered. But for since we are getting these questions from the audience to be so very specific answers we can give to them. So Dr. Bhattacharya, the question which we are getting is that does all liver diseases cause permanent damage, or there are certain diseases which do not cause that kind of damage, or maybe something like cancer?
Okay. So let me tell you, most liver diseases do not cause cancer. The commonest liver diseases that we see are common hepatitis A and hepatitis E hepatitis. That's the commonest disease that we see. And in both those hepatitis do not cause cancer because they evolve and they get cured on their own. Or they kill you by hepatic cellular failure. That's a different mechanism of that. That's the first part. Second is only those diseases which can become chronic, that is over a longer period of time, and can cause inflammation, cause cancer. Why? When they become chronic and they become inflammatory, there is a change in cell growth and cell recovery and an attempt to heal. For example, I drink, say, every day. I damage my liver every day, little by little. My liver tries to overcome this because it's a wizard. So when it is trying to overcome that, it starts to make a repair mechanism which goes out of hand. And that is how cirrhosis develops, and that is how liver cancer comes up on that. So that's one point. So you got to remember chronic disease along with inflammation. Question is, you might suddenly tell me, what does diabetes do in that case, and what does obesity do in that case? It's understandable. Hepatitis B, hepatitis C, alcohol can cause that. But what about non-alcoholic hepatitis? What about obesity? What about diabetes? Well, all of these carry a chronic inflammation with them. This is exactly what I was trying to say, and I think this is what Dr. Babu also tried to put across, that there is this chronic inflammatory disease which you have got to learn how to make the inflammation low. Uh, I don't want to sound parochial, I don't want to sound radical, but I want to make a statement is leading a sattvic life and taking a sattvic diet can actually put the liver at rest.
Thank you so much, Dr. Bhattacharya. Important statement, and I'm sure that is very critical for the prevention of liver diseases and cancer as well. Dr. Somasekhar, many time in our country, people uh, get alert about any problem in their body when they feel pain. And there is a question, from a audience also, that do we need to be worried about liver diseases or cancer only when we feel pain, or there is a way to kind of get to know about any such problem much earlier?
Okay, most of the time, people relate cancer to pain, misery, suffering, because they think that this is a dreaded disease. So naturally, it is also with misery. But not many people know, until it is into the last stage, most of the cancers are painless. Same with the liver also. Pain usually is a marker of a inflammation rather than a cancer. So in fact, sometimes I'm okay that if usually can be dealt with reversed, but not cancer. So if you are waiting that, okay, I don't have a pain, so I'm not going to do a checkup and I may not have cancer, is wrong. Pain is usually not a presenting feature of a cancer. Usually liver cell failure is one of the factor. In advanced state, when it comes out of the liver and touches the surrounding organ like bone or the diaphragm, other, that is when the shoulder pain, back pain, rib cage pain comes, and that is no longer an early tumor. It's usually little advanced. So even though pain is important for you to immediately present your doctor to further checkup, don't wait for the pain because it comes at a very later stage. So picking up with the blood test checkup is more important at early stage where it is easily curable than pain. So usually most of the cancers are symptomless in initial 1 to 2 stage. Symptom appear in the advanced later part. So that's why, especially in an organ of liver, pain is not the presenting factor usually.
Thank you so much. Doctors, Babu, in terms of, so let's say if somebody, as we discussed, that around 50% because of hepatitis B and 30% because of hepatitis C, if somebody has taken vaccination for both of that, then that person should be, free from the worries of liver diseases or cancer?
No, it's not. As we mentioned, there were so many, the reasons for the cancers we discussed about it. Vaccine is available only for hepatitis B, not for hepatitis C. So it's not available for hepatitis C. Hepatitis C, if the patient develops any hepatitis C infection, by giving treatment, you can reduce the chance of developing cancer, though you completely cannot eliminate it. So hepatitis B is one of the causes of the cancer. By vaccination, you can prevent it, but there are other causes of cancer, like, the obesity, diabetes, and all those things. There are certain genetic factors also which may contribute to cancer, but they are very less in number. So if you have taken vaccination, it doesn't mean that you are out of cancer. So you have to do all the things, because many times when you see a liver cancer patient, it's not because of single factor. There are multiple factors which are associated with it. So you have to keep that in mind, that taking a vaccine or doing only something will give you complete protection out of the cancer. You have to maintain holistically, see every cause of it, and try to have a very healthy life, I think that will give a protection rather than just thinking that I have taken vaccine and I am out of it.
Yeah, so along with vaccine, the healthy diet, healthy lifestyle and exercise, which you
Yes.
have highlighted, is very important. And also, Dr. Sirish has highlighted that. Dr. Sirish, there is one question, and I would like to ask you that question. That is there a way to understand or get to know that the alcohol which somebody is taking is causing damage to their liver? So as you said that some moderation may be fine, but how we get to know that the actual amount or quantity which is going in our body is causing liver damage?
So probably the one who has asked the question wants to know when to stop taking alcohol, so you can continue up to that limit before damaging the liver, and then you can stop later. But there's nothing like that. It's a slow process of damage. It's something like your diabetes, which damages the kidney or the retina. You can't really predict. So for the retina, for example, you have to keep on doing regular examinations by the ophthalmologist. Same way for the liver, you have to keep on checking by some blood tests like SGPT was mentioned, or even a basic sonography. So these things are there. So there's nothing like up to a certain level you can drink and then you are safe. And it's a, even if you stop drinking today, if you are suppose you are a heavy drinker and you have been drinking for the say past 10 years and then you stop today, you can develop liver cancer even after 10 years down the line, because the damage to the liver has started when you started drinking. The damage continues. As Dr. Bhattacharya said, there is something known as happens as a fibrosis occurs. So there's a constant attack or constant inflammation. That inflammatory process continues lifelong, and that leads to
Dr. Shiris, are you connected? There seems to be some. Dr. Bhattacharya, we talked about, and Dr. Sareen also mentioned about SGPT test. How frequently one should go for this test? You are on mute, sir.
Dr. Sareen mentioned that you have got to, like he said, it should become a Janam Kundali, that you look at the SGPT to decide if you're less than 35 and getting married. I'm not going to be so drastic, but I'm going to tell you something is that after the age of 25, there should be an annual checkup. This annual checkup should have a basic biochemical test. There are institutions in India where they do this on regular basis, specifically the army, the military and the police force, they do this very often. So if you can pick up in any of this SGPT that is high, okay, and if you follow that up within the next 1 month that is still high without the other being leveled, remember you're going into what is called a status of an enzymopathy. I think Suresh mentioned that there is a genetic disorder which actually causes this also. So that's the first statement. There is a genetic outlook for that. Such a patient has to be followed actually once in every 3 months with the SGPT. The initial value of the SGPT must be above twice that of normal to start this. Suppose 35 is normal and it is 40, you don't start it. But if 35 is normal and you have crossed 70, then you start that. Please remember that's the guideline. Is that perfect? I don't know. The second part of it is that you do it once in 3 months and keep seeing it. And if you find the rise being constant over 1 year, this patient should then go in for routine fibroscans to find out what is happening and get a alpha fetoprotein done. I do understand that alpha fetoprotein is not a perfect marker for hepatocellular carcinoma, but then that's a marker for a definite type of cancer. So please remember, if you have a raised SGPT, how else can this be picked up? This can be picked up very often that when someone goes for ultrasound for abdominal pain or goes for a gallbladder sting and they suddenly say fatty liver. They say fatty liver and then you get the liver function test done. You'll end up getting a SGPT more than 70. Then you start actually screening this patient, keeping in mind that this could be in high risk. I personally believe that this is a place where you add CRP, because that gives you a better idea of what's happening in the liver, and specifically we're using a high resolution CRP. That's a monitor, and there's data to this effect. You may ask me in the world whether they do it anywhere. They do it. They do it specifically in Korea, and they do it specifically in Japan as a marker.
Thank you, Dr. Somasekhar. You talked about the unique nature of liver, and we are getting multiple questions which are definitely about alcoholism. So, and Dr. Babu also said that it is not necessary that stopping alcohol will give you immediately kind of a surety that your liver is free from the chances of developing liver cancer. What is the way? So let's say if somebody stops alcohol today, how we can get assured that whether my liver is at a shape and health which is good, or there is a cause of concern. So at least you have one assurity that, okay, I have stopped this, now I'm at this situation and I can continue with that.
Yeah, see, the uniqueness of both alcohol and tobacco is it is in a irreversible stage before a fibrosis sets in. See, like liver is like a beetroot covered with a thin layer. As long as it is soft, the hepatocytes, the chemical factory is allowed to open, not compressed by a tight band. It can regenerate. It is irreversible. The moment a fibrosis means the liver becomes rigid, the fibrous element and the band covering becomes more tight than actually the soft liver, which is important. It doesn't allow liver to regenerate, grow. Then we enter a phase of irreversibility. From then, you can status quo stop it, but you cannot reverse it. Now, the uniqueness of alcohol and tobacco is it is on the duration and chronicity you take it, which is very, very important. So the day you stop alcohol and tobacco, the risk will start coming down only at the end of third year. Don't say that, oh, I have to wait today. It is like a mutual fund today and benefit 3 years. Share market can't I have morning to evening? No. So you stop today, you start accumulating that currency 1 year, 2 year, 3 year. Now you start getting the benefit of risk reduction in developing cancer. By 5 to 7 year, it comes down almost less than 10%, which means you become 90% normal to the common population. So it's a hard-earned money. It is not that it is like our investment. Start for your first job, you reap when you are at a retirement benefit. So the benefit starts at 3 year. Substantially, it goes to 5 years of stopping. By 7-10 year, it comes down very close, but it's never going to become 0%. But a 75-90% benefit is as good as normal people. So this is very, very important to understand, and then you protect it because you have only one life and one liver, and not easy to get a liver.
Thank you so much. We have tried to cover some of the questions, and many of the questions were covered in your inputs also. So we will have a last round of input which you want to give as a message, which as a takeaway message for our audience, that if they want to prevent liver cancer and also keep their liver healthy, what are the, let's say, 5 things they should do and 5 things they should not do, and also if you would like to include some of the tests and other preventive checkups which are important for them. So let me begin with Dr. Suresh Babu now. Dr. Babu.
Yeah, thank you. I think Sir Bhattacharya sir did speak about SGPT and also. I just want to raise one concern that if your SGPT is normal, that doesn't mean that tomorrow you go and start drinking too much. It's only significant when it is raised. When it is not raised, that doesn't mean that you are very safe. So the people watching the program should not think tomorrow I'll do my SGPT and SGPT is normal, so my liver is normal, I'll go and drink. So that should not be the thing.
It is like if you have been going out a lot and still you have not got COVID-19. And
yes, absolutely.
You don't start, removing your mask, going out again.
So
you can get at any time. Yes.
Yeah, absolutely like that. So SGPT is a marker, but if it is raised, then only it's significant. If it is not raised, it will never give you a false impression that your liver is absolutely safe. So as far as the prevention is concerned, I think we discussed this before. The 5 points is that if you are not vaccinated, get hepatitis B vaccine first. Number 2, you try to do modification in your diets, like avoid red meat, avoid consumption of alcohol, avoid smoking, and other the liver damaging whatever drugs if you are taking, you try to avoid that. Try to have more of vegetables. You can eat fish, it will give a very good protection for the liver. The third thing is daily you do exercise. I think one of the panelists, Dr. Shirish, was mentioning at least 45 minutes to an hour a day. It will not only give protection to liver, it will give protection to the almost every disease. It will give protection to your heart and all those things. The fifth important point is that you try to avoid alcohol, smoking, and other whatever habits are there. You try to avoid them. And the sir was mentioning about Afla Toxin, so you have try to have very good habit of the food and all those things. These are some of the very basic things you do, and very importantly, regularly you get checked for the things. There is most of the times the liver cancers are preventable when it is detected early. So most liver cancers are asymptomatic. As Dr. Somshekhar was telling, when you are symptom for liver cancer means you are almost in advanced stage. So you have to get it early. So, and the thing is that even if you have a liver cancer, if other part of the liver is very, very healthy, you can still save your life and completely resected. That is very, very important. So protect the liver. That's the things which I want to say in my concluding remarks.
Thank you so much. Very important point. I think that vaccination of hepatitis B is very important, as you mentioned, and also about exercise and healthy diet. Dr. Series, I would like you to have your remark, but at the same time, I have got one more question, and it's very pertinent for you. Gujarat is known largely a vegetarian state as well, and there is a question that if I'm a vegetarian, does that give me kind of some protection from developing liver cancer or having a diseased liver?
Okay, so it's basically not just liver cancer, but as someone mentioned, it's the red meat which is important. So if you reduce the amount of red meat, of course, we don't eat much of red meat in India, at least in our part of the country, in Gujarat. Yes, behind the closed doors, yes, even people do eat a lot of non-veg outside the houses, but not inside the houses. So just non-veg as such, if you reduce the red meat, definitely, yes, it does reduce the chances of developing, say, any damage to the liver or anything, even heart for that matter.
Yes, and what would you like to add, sir, in terms of making people, more conscious about prevention?
I mean, everyone has said just one liner: love your liver and love your body. That's all, and you know what to do for that. Nothing much beyond that.
That's very strong and very important message which you are giving. Dr. Soma Sekar, your last remark on this.
In our life, we don't know the value when we put it for ourselves. So I always say that don't live for yourself, live for your loved ones. When you're driving back home, the ad is protect your head with helmet, not for yourself. There is somebody loved one waiting in the home. So keep your liver, because you have to live not for yourself, but your loved one back home. Then you will understand what wrong you should not do to damage you. A general thing I want to leave, not just for liver, unfortunately in liver, unlike other cancers, like oral cancers or breast cervix, screening has not yet been well developed and not yet proved to be highly efficacious. Unless you have a cirrhosis where you are highly prone, then alpha fetoprotein and scans are useful. In general, on the birthday of your loved ones, morning, don't get up and take them for a diamond necklace, food. Ask yourself, did I take all the measures and give my family and myself a liver protective thing? Good nutrition, antioxidants, 30-40 minutes of vigorous exercise, being thin and lean, making myself, my family, stop all bad habits like tobacco chewing, smoking, alcohol. Give this along with cancer screening package once a year on their birthday. Then evening you go and enjoy your evening and live for your loved ones, not for yourself. Then all organs you'll protect yourself. And that way family, society, nation, everybody will get protected.
That's again very important, and gifting yourself to your family, look for being with them for as long as possible. That's very important. Dr. Bhattacharya, your kind of concluding remark for this session. Dr. Bhattacharya, yeah.
I'm going to try and put it, because I brought in the term social determinants of health.
Yes.
Find as something that we all should be spending more time. So on that angle, I'm going to start by saying Get aware of liver cancer. You have started a good job. Please keep doing this. And I would say, like people say, October is pink. Say October is emerald green, the way Soma put it. So I think that's very important. Awareness. If you're aware, then you will be aware of what's happening. Second is get vaccinated for hepatitis B. Get treated for hepatitis C. That is very important. Walk 3 miles a day. I think Suresh will agree with me. That's a perfect method of saying walk 40 minutes in a day. Okay. Lead a healthy lifestyle. Avoid alcohol and tobacco. Screen whenever it's possible and whenever it is necessary. Keep your blood sugar under control. Keep your weight under control. And last but not the least, I like this statement very much, is put across by saying, love your liver and your liver will take care of you.
That's very important. Thank you so much, all of you, for putting across this information and this message of preventing liver disease and actually promoting liver health in all possible manner. So thank you so much for your time and for your wonderful guidance. If our audience have more questions, you can send them through to us through WhatsApp, or you can use the link of WhatsApp in our Facebook page and send your questions. And also don't forget to follow us to stay updated on all that concerns your health and well-being. This program was supported by Lupin Oncology under its public awareness initiative. Stay tuned with ISW platforms for several live programs on all that you need to know to preserve and promote your health and well-being. And keep sending your questions. We will try to include them in our upcoming shows as per their relevance. Till then, stay at home, eat healthy, stay at home as much as possible, because the lockdown restrictions are not there, but it is very, very kind of wise to avoid going out as much possible, as we know that the threat of COVID-19 is still not over. So eat healthy, sleep well, and keep giving your mind and soul a daily dose of positive thinking. And don't forget to maintain personal hygiene, social distancing, and to protect yourself and your loved one from the ongoing coronavirus. Goodbye and see you soon.